to understand how major tech companies and venture funds are shaping the future of healthcare in our country. We have an extraordinary lineup of experts to explore this topic so far. Please join me in welcoming Mr. Febi Abraham, EVP Chief Strategy Officer, Harman Health System, Neil Gomes, Chief Digital Officer at AmeriHealth Caritas, Dr. Lakshmi Jagannathan, CEO of the Innovation Center and EVP of the Comet Foundation and IITB, Dr. Divleen Jeji, India Lead at Google Health. This session will be moderated by Mr. Vishnu Saxena. Let's give a big round of applause to our distinguished panelists and moderators.
I'm very honored to have very esteemed guests right now. Let me start from my right, Mr. Neil Gomes, Chief Digital Officer at AmeriHealth Caritas, long-time healthcare executive. He has experience across both sides of the aisle. He has been head of a group called DICE, Digital Innovation and Consumer Experience. Whatever I have talked, a lot of things I have learned from Neil. And so he was the head of DICE at Jefferson Health, one of the largest, most reputed, and oldest health system in city of Philadelphia. And now he's CDO at AmeriHealth Caritas, which is one of the reputed health plan. So welcome, Neil. Welcome to DHN Forum, first of all, and thanks for making from Florida to here. Ms. Lakshmi Jagannathan, she's an excellent senior healthcare executive. She runs the innovation department and innovation center at IITB. I had a pleasant meeting with Ms. Lakshmi at a couple of weeks back in Bangalore. And IITB is also very honored to be part of our Health Tech Innovation Challenge. So Ms. Lakshmi, thanks for joining at DHN Forum. Of course, Febi Abraham. Febi has a long resume, big credential, former McKinsey partner. You have heard him in the first half, and currently at the Executive Vice President and Chief Strategy and Innovation and Investment Officer at Memorial Hermann, one of the largest health systems in US. So Febi, thanks. Febi brings the unique perspective on innovation, investment, big tech. And of course, Divleen Jeji, thank you so much for coming from Delhi. And welcome to the DHN Forum, first of all. Looking forward to your insights. So she is the Google Health India lead, based out of Gurgaon office. Excellent. And of course, my name is Vishnu Saxena, founder and CEO of Scale Health Tech and Digital Health News. Now, what we are going to talk about is the impact of big tech and venture investment in healthcare, right? So, what we are, in fact, I was thinking, such a great panel. Neil on the other side, he brings the tremendous consumer experience and all. Let me open the floor, Febi, with you. You have, worked with variety of, big techs, right? A lot of them, right? And if you see for a second, the impact of the big tech in the US healthcare, and I will try to contextualize and try to understand what is the case, the big techs focus in the India, and Devlin, you can throw some lights on it. Big tech has a lots of influence, lots of penetration, lots of focus in the US, whether it's Apple, with the Apple Health, EMR, the Epic is connected. So, a bunch of health systems came together and go to Apple's Health Kit and get your patient data. Everything is seamless. Microsoft, doing lots of things. Azure, Nuance, and, dictation, big physician burnout reduction, a lot of success there. Though there is another thing that lots of competition has come up for the Nuance. And Azure and whatnot, right? Amazon Health, Amazon Pharmacy, you name it. Big focus on healthcare. And of course, Google, I can't miss it out. Google Health, Google Cloud, they're doing lots of things. Tremendous. AI automation and all those things on the Google Cloud, right? I have lots of health systems. In fact, you might know Hackensack Meridian Health in New Jersey. They are all Google. They're all Google. You can't find, I went to the CIO office, Kash Patel's office, nothing. There's no Microsoft. Sorry, Microsoft, if you guys are here. So the point is, the big tech have a big, huge influence. And they're driving the business outcome and the patient outcome. But at the same time, things may not be as rosy as well. So Femi, I wanted to take your, because you can see from both sides of the aisle. So what's your take? And then Devlin will come to you in terms of the India perspective.
Yeah, no, I think it's a very evolving marketplace right now with big tech and healthcare. Historically, they have gone, like if I would break it down into at least 3 buckets of influence, one is data and storage. The second is analytics and applications that tie towards analytics on the data that provides insights and decision making to leverage something from the data. And the third is healthcare delivery itself. And I think if I sort of map out the large tech companies, largely I would say Google, Microsoft, and even Amazon to some extent have or Amazon have all focused on the first and the second part of the stack. Amazon and Apple are probably the furthest along in the third part of the stack, with Apple more on the consumer end of the healthcare delivery through Apple Watches and other devices that provide the connected ecosystem, and Amazon actually entering healthcare delivery. So they've now purchased a pharmacy. They also have One Medical, which is in the United States, which is actually doing care delivery. So you can have $100 per year, $99 per year subscription, virtual health access to Amazon Care as well. So I think as I sort of go into each of those parts, the role that they can play on data and storage is very clear with Amazon Cloud, Google Cloud, and Azure. And so I think that part is super clear to me in terms of the cost of storage and compute and partnerships that the healthcare delivery ecosystem can have with them. When it comes to applications, I think there are both hits and misses, and that's what makes my answer be more of an evolving marketplace perspective, where in some cases they have actually created next generation products. For example, you mentioned the Nuance one or not ambient listening. There are other such applications being developed by Google has the Verily arm that we believe are creating the right set of applications. What I think they're still sort of figuring out, in my view, at least from the US healthcare perspective, is they've not yet figured out go-to-market.
Right.
So in many ways, they first created the product and they believe that the tech and the product are the answers to every problem. But it goes back to the point I made about the hammer in search of a nail, which is earlier in today's discussion, which is how are they making sure that the adoption of those products are happening in the clinical setup? What are they doing with physicians and with health systems to make that happen? And that's very unclear from my perspective. And so that's why adoption is rather mixed, at least in the United States. And I'd love to hear the India perspective. And then on the care delivery side, I think many of them have scratched the surface. Actually, if I expand it into Walmart, Walgreens, and CVS, they all thought that the way one purchases grocery or consumer products, you can also translate that into healthcare, and they've failed miserably because people don't just go to buy grocery and say, oh, I'm going to see a doctor there. It's not a same purchase. And so I think Walmart has unwound its business in healthcare. Walgreens is significantly scaling down as a CVS. And I think a lot more of Amazon through One Medical will now be done, in my view, if I had to predict, through partnerships with health systems. So there is an opportunity for them to sort of say, hey, we are the tech producers. We know how to create next generation products. How do we sort of work with the provider ecosystem to bring those products that actually consumers need, physicians need, and leverage a lot of the solutions in that. So those are the opportunities and what I think they've failed in, what they're succeeding in as well.
Excellent, excellent. Devlin, I'll come back to you. I need to get Neil speaking. So Neil, in your previous role at DICE and your current role as the CDO of the large health plan, I think you worked day in and day out with big techs. Now, what are the hits and misses? And where do you think, of course, as Feby said, there are certain things that are very clear: storage, automation, compute all those kind of things. What's your perspective in terms of how they are bringing outcome change? And then if you want to share some perspective on India, feel free to do so.
Yeah, sure. I'll start my journey a little bit earlier than healthcare.
Awesome.
Because I draw a lot of inspiration from education. I'm an academician myself too. So, but I worked in the digital education industry many years ago. I was here in Bombay working for the Tata Group of companies years ago, and we started up a company called Tata Interactive Systems, which they sold recently for several $1 million, hundreds of millions. And you know, at the time, it was digital education was seen as this major disruptor, and that all the universities would be gone in a few years, and there was that reticence early on the academic side. Corporates loved it because, you know, they saw this as a cost-saving kind of thing, and so they got on really early. But academic institutions didn't. But over time, as I worked with the University of South Florida after that, studying there as well as building USF Online, which we built into about a business that made $360 million a year. For a public state university, it's pretty big earnings at a cost of maybe a tenth of that, including all costs, even faculty. So a pretty big return on investment, right, 10x. And you've seen that evolution kind of continue. Now you can take an online degree from MIT or Harvard, even if you want to, being in India, right? And that's how I did my executive MBA, was with Brown and IE Business School. IE Business School in Spain, Brown in the US, and you know they somehow got together and did a on location and online kind of exec MBA. So taking that, right, and how it was enabled, a lot of that kind of work was enabled by big companies like Google and Microsoft, providing the core infrastructure many times to education.
Sure.
And many times that, at least in education, it came about because they wanted to do something good for education, as well as Sundar Pichai has also invested in India with the 10 billion fund, right? He's zooming out, which I love when CEOs do that, because instead of going deep into the problem, they zoom out a little and see how they can enable a solution that's a little bit broader. So if you want to improve healthcare, well, get people to understand digital first, right? So educate people. So I think that's really important. I think that investment is going to be good for that. And that's what Google and Microsoft did in education too early on. Now, getting into healthcare, it's a more complex kind of scenario, right? So it's a little bit more difficult. It requires a lot more partnerships, I feel. I've done a lot of work when I was at Jefferson as Chief Digital Officer there. I did a lot of work with Microsoft, Google, Apple, IBM. I was on IBM Watson's advisory board and on Google's Leaders Circle. Worked closely with TK at Google Cloud, as well as Diane Green early on, as we were working with DeepMind and other organizations that you'd acquired. And as we were doing that, built a lot of really good applications, but always thought about scale. And that's the good thing about these large organizations. They love scale, right? So with Google, for example, we used the Vision API very early on. Our chair of radiology at Jefferson was also the president of RSNA for some time. So we got some really good, Dr. Vijay Rao, we got some really good collaboration from Google, and she had data scientists on her team. So when you collaborate and do those types of partnerships, we built a lot of really useful solutions, both for India, because through Global Jefferson, we could take some of this work and apply it in India too, where you have a lot of X-rays, lots of CTs, sometimes they don't even go analyzed. Even worked with South Africa, a very large hospital there, worked with KLE in Belgaum, AIMS in Delhi. And through those collaborations, we were able to expose some of these algorithms that we built in the US, also on data here. Okay. So those partnerships really helped. And then finally, I think what is also important, so education, application directly into large-scale kind of things into organizations, healthcare organizations, and finally funding some of this, as Google's doing here in India, of this innovation enterprise within healthcare organizations. Because at least in the US, healthcare organizations are a low-margin kind of industry, right?
Yeah.
I mean, we certainly have a lot of earning. Like the payer I work for right now, it's a $25 billion revenue organization. But typically with payers also, at least in our industry, the returns are about 2%, 3%, so it's still a lot of money, but it's not like the software industry, right? And so we need your help to accelerate healthcare and the digitization of healthcare in the US and here too, I think.
Excellent, excellent. Thank you, Neil. Great perspective. Divleen, so what's happening in India? What Google? So, like India, as I always say now, most populous country, big tech can do a lot of things, not only from the technology point of view, but on the corporate social responsibility point of view as well. And then there's, of course, Google, as you know, we all know, has a big focus on trying to, bring the equality, and trying to bring the technology that can bridge the gap, right? Like social determinants of health, or and whatnot, and try to help the underserved, right? So, can you talk about in terms of what's your perspective? You have been with the Google Health, how Google Health is thinking about India when it comes to healthcare, and where they are, what they want to do, be either through technology or through something else, and then what's your view in terms of the impact it can bring on the patient and the healthcare organization that you are going to serve through technologies in their business outcome?
We could spend the whole day discussing.
Yeah, I know.
But I think, so Google thinks of health as a very important area to invest in, from resource, technology, as well as being an influencer in the larger ecosystem. And as was already discussed, big tech loves scale.
Yeah.
And I think India is the place to be if you want scale, given the way we're structured. And I think the third thing, which has been an enabler and a potential opportunity area, has been the kind of importance health has taken up for the public sector all of a sudden.
Okay.
It's been something which is, I would say in the last 5 odd years, health has become a talking point across the board. Whether it is for, and it's just not limited to the Ministry of Health, it's kind of across the board, where I think every single government body today has a mandate to either invest in health in some form or the other, upskill the last mile workers in order to be able to provide better information, take better decisions when it comes to, health at the grassroots level. And there is an entire resource, technology, infrastructure upgrade movement in a manner, so that the public sector kind of catches up to the private sector as we go along. I know it's a very large initiative, which is why it's distributed across the board. But I think that has been something which is, again, an opportunity and a very large challenge as well. For us at Google, we look at health as a very big opportunity in India from both a consumer as well as an enterprise lens.
Okay.
So when I say consumer, we do consumer very well. I think that is one of our strong points.
Sure.
So we're looking at empowering consumers with authoritative information through some of our platforms like search, YouTube, where people, so I'm sure, I don't know how many of you know this or not, but there's data now that says that Indians first go to YouTube to search for health and then go to search.
Oh, is it?
Yeah.
Okay.
And there's, if again, very mind-boggling statistics, 20% of health searches on YouTube in India are on mental health.
Oh.
Which is, again, a very mind-boggling statistic. And if I were to tell you the number of health searches we get in a day, it's going to be like, it crosses millions. So for us, it's a very big opportunity area. We're working, we like to work very closely with, the WHO. We like to work very closely with local partners as well. And we want to be empowering local language content so that it's not just limited to English or to Hindi. Eventually, we want to be getting down to the Indie languages so that that entire equitable component of health information is covered. And that is an initiative that we want to roll out across YouTube, search, all of our consumer platforms, basically. From an enterprise perspective, there is a lot of opportunity, but as we've discussed in previous sessions, digital transformation is a journey. If you were to open up Google search today, or if you were to just look at like trending searches, LLM is huge. Large language models, AI models, and their applications in health. It's very nice to read about it, but when you start to look at applications of it, or like real world applications and adoption, as was discussed, it becomes an upward journey.
Correct.
So I think there is, of course, an opportunity, again, like I said, both in the public sector and the private sector, but getting that baseline infrastructure ready in order to make sure that those AI applications, those large-scale analytic models can be deployed, there's still a way to go.
Follow-up question to you, Divleen, on it. Google does lots of partnership with innovation centers,
Yes.
incubators,
Yes.
or health systems. They do lots of things on a compute side. Or if it is, let's say, a hackathon or something, those kind of things are happening. So everything
Yep.
through Google, right? Where you guys are when it comes to India, are you looking at those spots? If it is hospital-led, or if it is any other enterprise-led, are you guys open to look at it and see what the meaningful partnership could be that can support, that can allow Google Health or Google's technology to be showcased, leveraged, while driving the outcome on the other side?
So yes, we're definitely very open to it. We've done a lot of work around it as well in the last few years. We have something called as the Open Health Stack,
Okay.
which kind of enables your data to be FHIR compliant, FHIR compliant, and then it also enables for interoperability to be built in. It's an open source. It's an open source platform, and we run workshops across the board to enable developers to be able to use it and actually build further applications around it. There are a few other such services that we have available in the open source. We also collaborate with a lot of national level bodies where we host workshops, again, for people that are nominated to be a part of it. We're also at this point in time looking to partner very closely with national governments, national programs, state governments, state programs to facilitate that entire ecosystem development, as you're saying, so that digital transformation does not seem like this unachievable journey.
Okay.
And we're very happy to partner, facilitate, provide resources across that entire spectrum.
Sure. Excellent, excellent. Thanks for that, Divleen. Good to know the Google Health is serious about it, driving the, the outcome in the healthcare segment through state, through federal, and across variety of the channels. So both on the consumer side as well as on the enterprise side. So thanks for that. This Lakshmi. So you run the innovation center.
Sure.
In an premier academic center. As a researcher, let's see as a researcher, as an educationist. How do you see, when you see big techs coming, Microsoft, Google, and you are in Bangalore, Silicon Valley of India, right? You see lots of technologies are coming. They have a greater impact for a country like us, our country, where technology can solve lots of challenges, right? Provide lots of outcomes. And then if you supplement that with venture fund investment, that can provide that scale. What's your perspective when you combine these big techs focus on driving the healthcare outcome, better healthcare outcome,
Sure.
and then innovation and investment? What's your take? Please guide us.
No, I think the best way to make elephants dance is to make them dance through ants.
Nice, I like
Right.
that.
I mean, because startups are so agile, so fast, so dynamic. So the best way that corporates or big techs can work is to work with startups to foster innovation. So the reach is much faster. And all these big techs, you talk about Google to Cisco to Intel, everybody has a startup program. But it stops at the program. Because there's nothing much it could do. I mean, I'm being very frank. Maybe offering some part of a technology support or some stack, or Intel could be giving their boards free, or stops there.
Okay.
Primarily because health has to be at the root. Because she was very right in saying you have to see adoption on the ground. And I've been in the healthcare, I would say, startup incubation, innovation ecosystem close to 15 years now. So I think from morning I was waiting for my chance to come because everybody was saying, oh, startups come with that, come with this. How can hospitals make it happen, right? See, at the end of the day, why is somebody doing a startup? Somebody is doing a startup because it's a business proposition. He wants to make money for himself, right? He is not hell-bent on solving only this particular problem. If there's a clearly defined problem put in front of him, say by a hospital, by a clinician, or by somebody from the clinical side, he would just grab it, build a solution, make money and move forward, right? That's not happening.
Okay.
That's not happening. I mean, if we are able to bring this together, see, there's something called reverse pitching. If hospitals could reverse pitch and say, these are my problems, then we can get big tech guys to support those problems through technology support, mentoring, tech development. Startups would be more agile, building this, making it happen.
Do you think, just follow-up question on it.
Yeah.
If I mean, you can finish your thoughts, sorry if I jumped into it.
No, I'll just come to the venture part of it. In fact, today what's happening, being in the, I think morning, Dr. Ganapati was talking about the government funding.
Right.
I think today, if somebody wants to be an entrepreneur in the healthcare domain, up to 2 crores of money can be easily raised through various government schemes. So there are enough government schemes available, but the ecosystem for health, see, EdTech is a much easier domain because you can get into a school, talk to teachers, validate, build your solution, pivot it. It's not happening in healthcare. It's not happening in healthcare. I mean, that's a fundamental problem, right? You build something, how do you know it will work? How do you scale? Where do you deploy? How do you fine tune? Tech is not the problem. I think the opportunities for fine tuning, co-creation is a challenge. See, I would have at least worked with about 600, 700 entrepreneurs in the last so many years. At least 60, 70 of them have a physician or a doctor as a co-founder. All of them have done phenomenally well. See, there's one of the doctor co-founder from a hospital in Bangalore. Now, when he got a funding, the hospital opened up doors. They said, you have money, you want to hire a nurse, you can hire a nurse. So he started doing his clinical trials, validation in the hospital where he was working.
And I can totally relate, Ms. Lakshmi, on that comment, and of course on the previous one as well. And Neil and Fabi, you can attest to that. When the digital health startup boom started to happen in 12, 13, or 14, it went to the sine wave that suddenly it's gone, and then they realized, the innovators, that hey, they don't have chief medical officer on their board. They're trying to create solution, but it is not clinically vetted. They're trying to approach through tech, but it was not a clinician included team. So to your point, and I think that was very valid, and I think that's changing. Now, you wanna introduce? So I think we got 1 minute, and I think we have one other panel. So we'll be real quick. Divleen, what do you think? What do you see from the Google Health's eyes, when you see, what are the challenges you see in terms of barrier challenges that you see that if it is not there, then potentially Google can drive more outcome on the healthcare side, and the business and the patient side?
So, 2 things. One is currently the baseline infrastructure is not enabled, or is not, I would say, it's not capable of driving the kind of compute that it needs to drive. So we also have to think about it a little bit differently. I think when it comes to India, it's a highly price-sensitive market. It's not that people don't have money, and it's not that they don't want to invest. It becomes a choice, right? Do you want to spend $1 million installing 2 CT scans, which will lead to an immediate return on investment? Or do you want to spend $1 million deploying a Google Cloud solution, which will enable you to further have large AI models for deployed? It'll bring more efficiency into your operations. The ROI on that will be possibly in the next 2 to 3 years. So it becomes, that is, I think, that's the crux of the market, number one. Number two, as ma'am already pointed out, it's an ecosystem play. I'm not saying the technology is faulty. It is not by any stretch faulty. You can test it in any environment, it will work beautifully. But when you deploy it in a real world setting, there's a regulatory challenge. There's a skilled worker challenge. There's an end-to-end incorporation into your existing patient journey challenge. Then there's a very large challenge of monetization. How do you monetize a particular technology that you've introduced into your workflow? All of these pieces, I think, I'm not saying they can't be solved, but it just makes the process a little bit slower. So that's what I was hinting at earlier, right? It's important to educate your user. It could be an enterprise user, it could be a consumer. It's very important to educate them in their language, help them build trust, eventually make them understand why something like this is important, and then go from there. It's an upward journey, and quite, I think, I like to call it a change management case study. But from an opportunity standpoint, given the headwinds around health, I think in the next 5 to 8 years, the way health is practiced in India, any doctor for that matter, or any large hospital, or just the entire patient experience is going to change completely. Like right. 1mg, Tata 1mg is such a brilliant case study in terms of the things that they've been able to solve.
Correct.
Similarly, like the entire e-pharmacy space, I think there is no other success story anywhere in the world like it is in India.
Correct. Excellent, excellent. Yeah, and I think when you say the foundational thing, so foundational means also like not a wide adoption of core EMR, EHR technologies by the hospital in a foundational baseline.
Yes,
that's
so
also one of the challenges that they are not able to leverage the things that Google Health has to.
You should, next time you're here, you should actually go visit like 3 large hospitals. They will tell you 6 different versions of EMR running within the same hospital. It's a fact.
Oh, I got it. Not very different. We have some Cerner, Epic, and Meditech and all, but yeah, got your point. Thanks. Fabi, what do you think, from your perspective, when you zoom out from Houston, look at it, zoom in, sorry, the big tech. What are the opportunities for you?
So ultimately, as Lakshmi, you pointed out, I think what will happen is we at health systems cannot wait for big tech to come up with solutions. And they may have solutions. It's not the product. It's an integrated product solution paradigm. And we'll drive our own innovations. Usually the debate that happens internally is, should we wait for a platform or should we select a best of breed approach that works now? And we will select the best of breed approach right now. For example, you take ambient listening or many other AI applications that improve productivity of the workforce or applications that improve clinical decision support. We're going application by application, and as I mentioned earlier today, we're picking the right digital health mousetrap that works. They're not big tech, but there are some shortcomings of working with small to medium-sized companies. And over time, do I see them getting consolidated within a Google, Amazon, Microsoft paradigm? Potentially, because they'll have benefits in compute, they'll have benefits in storage and customer service, and sort of truly taking an enterprise approach to that, which, quite frankly, at least as you mentioned, there is a lot more focus on the consumer right now and sort of solving a government mandate-driven approach. Same is true in the US too. That, I think at some point they'll have to work through provider and they'll say, hey, maybe there is an opportunity for us to sort of create that integrated solution, probably through M&A. And so I do think that there is probably going to be a consolidation over time. and there will be an opportunity for big tech to leverage their